Robert F. Kennedy Jr. has been leading the Make America Healthy Again movement. RFK Jr. is the United States Secretary of Health and Human Services. I just spoke with him. Mr. Secretary, nice to see you again, sir.
You too, Greta, and thanks for having me.
You have said you want to make America healthy again, which I think is a very laudable goal. We all want that. But I'm curious where you think, where did we go off the track? How did we become less healthy? And about when did we start making that turn?
Well, you know, it started really, I think the real insults to human health began, America's health, the decline of American health really accelerated in the late 1980s, the early 1990s. And a bunch of things happened then, a bunch of new exposures. And at that time, Greta, the tobacco industry took over the food industry. So by the early 1990s, the two biggest food companies in the world were R.J. Reynolds and Philip Morris. And they began moving scientists from the endeavor of making tobacco more addictive, develop new lab ingredients that would make food addictive. And they began adding sodium and sugars to our food and other chemicals to mimic tastes, but not to provide nutrition. And our food itself became more and more ultra-processed. It's less nutrient dense, and it's more reliant on chemicals. And those chemicals were largely untested because due to the capture of FDA by the food industry and by the drug industry. And they were able to weaponize what is called the GRAS standard, which is a standard called generally recognized as safe. When FDA first began regulating foods in the 1940s, it exempted food ingredients that had been used for generations, like wheat and eggs and dairy, et cetera. And it said, we don't have to test those. We're only going to test the new stuff. And they applied a label called generally recognized as safe to those ancient ingredients. The food industry was able to capture that and apply it to every new chemical that was added that they wanted to add for food. So we have 10,000 ingredients in our food in the United States. In Europe, they only have 400. Because in our country alone, chemicals are never tested, safety tested before they're added to food. So we have all these petroleum-based synthetic food dyes, and we have chemicals that mimic the taste of strawberries and blueberries, but there's no nutrition in them. And your body, if they trick your body and hijack your brain into eating more and more food and getting less and less nutrition. So we're now the fourth most obese country in the world, but we also have, for the first time in history, this phenomena where obesity is accompanied very often by malnutrition. The people who are most obese are also malnourished, and that's never been seen before in human history.
Let me bring the question of obesity. There are some new obesity drugs, Zepbound, Ozempic, Ozempia, whatever, I can't remember the name exactly, but those are very expensive. And it seems to me that if we made them available to those who wanted them, that would help them. It would take some of the cost on health, on heart, because if you're overweight, you're putting a lot of stress on your heart. It would save some money, save your health. Also a little bit self-esteem. But these drugs that may be sort of beneficial are out of reach of so many people.
Yeah, and that is an issue. For us, it's mainly a cost issue. These drugs are very expensive. Ozempic is sold for about $1,300 a month. And in Europe, by the way, in England, you can get it for $88 or $88 a dose. We pay $1,300 a dose, which is a weekly dose. And if we made that so that Medicaid, Medicare paid for it, it would, and that private insurance companies had to pay for it, we would double the cost of health insurance to most employers in this country, and that would really be destructive. So these are miracle drugs in many ways. As you point out, if you can reduce obesity, you're also reducing diabetes and heart disease and a lot of other comorbidities. And it's something that, could be very beneficial to many people in the American population. And right now, the big impediment is really price. And we're negotiating that with the drug companies and seeing if we can at least launch some pilot programs, or if we can get the price low enough, we can make it available at government cost to everybody.
I'm a vegan by choice, but I'm not so sure all the vegan food I necessarily buy is so healthy. But in many ways, it's a luxury because it's a little harder to navigate a vegan diet. My husband's not one. I mean, I don't push my vegan diet on anybody. But I've seen the president eat hamburgers and French fries and Diet Coke. How's your diet? What do you eat? How are you doing?
I eat a lot of protein. I stay away from packaged foods. I eat whole foods. If it comes from the ground, if it comes from an animal, if it comes from the ocean or from the air, I will eat it. But I don't eat anything that comes in a package. And that's, otherwise I'm pretty eclectic in my diet, and I do eat a tremendous amount of protein.
Let me go back to the FDA, and maybe you can help me out on this one. I know you're not a doctor. I'm a doctor. We're both lawyers. But sometimes the FDA has a very Byzantine cobweb process for getting good, important drugs that are safe and effective to market. And there is one drug, and I'm not asking you to, I know you can't do anything about it. You're not a doctor, but I would love it. I talked to Dr. Oz about this drug. I would love it if you could ask the FDA to just look at it for accelerated approval, because it's been found safe and effective, saves lives, which means saves money. It's called pelacarsen, and it's a drug. It's a drug to treat something called lipoprotein A that Dr. Oz, who's one of your colleagues, and I discuss all the time. But it's stuck in this long process of approval, despite tests showing it's safe and it's effective, and obviously, and actually, I have a family member, which is my self-interest, who desperately needs this drug. Can you just ask them to look at it for what's called accelerated approval?
Well, yeah, I'll talk to Marty McCary about that, who's running FDA. What does Dr. Oz say about it?
Well, he and I talked about lipoprotein A is something that 15 to 20% of the American population have, and it's like putting a time bomb in your chest. You know those stories where you see someone who's physically fit, runs, gets exercise, all of a sudden drops dead. It's oftentimes a cardiac issue associated with lipoprotein A, and there hasn't been a treatment for it until now. And that's this pelacarsen, and it looks like from all the studies, and I'm not a doctor, don't pretend, I don't even try to play one on TV, but it looks like it's going to be almost a miracle drug to treat this for 20% of the population if they want it. But it's going to take more than a year to get to market, and it's because of our FDA regulations, and it's going to save an awful lot of money, healthcare costs, if people get it. And it ought to be on market now and not have to wait, continue to wait. It's going to get approved in a year, but in a year a lot can happen to a lot of people.
Well, I will check with Marty. I mean, Marty McCary, who is now running the FDA, his ambition is to accelerate the approval of drugs that work. Of course, they need to go through the regulatory process. They need to do placebo-controlled trials and phase 1, phase 2, and phase 3 trials. We're figuring out all kinds of exciting new ways to accelerate that using AI. And for the first time, we are now getting the same computer system and the same software into all of the different divisions of FDA, and we're going to be able to look at data much more quickly, and we're going to be able to do these approvals a lot faster than they were done in the past.
What surprises you about your new job? What do you like about it, and what don't you like about it?
I really love the job. I feel like I was made to do this job. And the team that we have here is extraordinary. There are a lot of people who are coming to HHS now because they see an intergenerational opportunity to really change the way that we're doing things, and we're moving very fast. We've announced a ban of all the petroleum-based synthetic food dyes. We have changed the GRAS standards so people can't get a rubber stamp to put chemicals in our food anymore. we're going back and reviewing the chemicals that are in our food. We've launched Operation Stork Speed to make sure mothers in this country can get the healthiest milk for their children. We're reviewing the food standards. The food dietary guidelines were captured by the industry for many years, and that's why Fruit Loops was the top of the food pyramid, which is absurd. And we are now doing real science-based, gold standard science, and we're going to have a very, very comprehensible. The dietary guidelines that we got from the Biden administration that we inherited were 453 pages long, and they were incomprehensible, and they were really just a template for industry capture, for promoting bad foods that people should not be eating. We're going to have a very simple, I've asked them for a 4-page guideline that can tell people to eat whole foods, eat meat, eat protein, eat vegetables and fruits, and try to eat locally. Try to find local sources of your food, and then we're going to make that very comprehensible, and that's going to change the school lunch program. And I think it's going to have a dramatic impact on public health in this country, particularly for our children.
People think news just happens. It doesn't. It happens because there's someone there to capture the moment, to explain it and share it. That's my job. I go where news breaks and give you the facts. Join me for The Record on Newsmax.